to the Cosmetic Podcast.
This podcast amplifies the topics you want to hear about.
Cosmetic means being a person or thing that gives rise to a phenomenon that is dynamic or energizing.
Globally minded and locally focused.
I'm Rodrigo Robb.
I'm Keith Benson.
So today we are talking about light the dark, this dynamic of race, poverty, and COVID-19. So according to Johns Hopkins University, they did a study and they said already from preliminary data, it's becoming evident that a grim trade-off is being made between saving the lives of those who are most vulnerable to the COVID-19 versus saving lives of those who are most vulnerable. And this idea of how race and poverty and systemic issues are really being amplified during this critical time.
And right now, they don't have the data all laid out. In some places it's better than others, but this virus is going to infect a whole lot of people.
Yeah.
It's not, regardless of what your wealth is, regardless whether you're poor, regardless whether you're white, black, it's gonna impact a lot of people, and it's gonna do so on a real long-term basis, because the way we live today is not gonna be the same as we will even 10, 20, 30 years from now.
Right, and the whole structure, the economic structure of our country, people are already talking about how things will be different, how people will go back to work, the speed at which we'll return back to work probably won't mirror the speed in which we stopped working.
Right. And one of the big things is that when you talk about individuals who may make a lower wage, a lot of time that's tied to a lot of different type of jobs, like in retails, maybe your grocery stores.
Yeah.
And those individuals, while they are in some places, they're essential workers right now. Those are our most important workers, and very proud of. I know when I go in the grocery store right now, I'm thanking them for stocking the shelves, because man, if they were not doing that, but yet instead, that's not going to be the job that's going to have a higher income to be able to live off of long term. And so they're going to get impacted by this in so many different ways.
Yeah. And then the reality is, so Human Rights Organization identified that in the United States, economy inequality is really closely linked to racial divide, right? And so those same individuals who are working in those positions that may be exposing them more are typically lower paid, and they're predominantly Black and Hispanic. About 21% of Black people and 18% of Hispanic people live under the poverty line, whereas only 8% of white people live under the poverty line in this country. And so when you start thinking about, being poor and having to go to work, or having to decide between going to work or sheltering in place and staying home to protect yourselves, that's a really tough decision that many folks are being faced with.
Yeah, and as we look at this virus, again, the data's not strong just yet, but it is leaning towards a lot of predominantly Black cities have higher rates of the virus.
Yeah.
And they can't, wrap their hands around that. I know the health director here in Dallas County is talking about DeSoto. DeSoto is a city that is about 50,000 in its population, 68% African American, but it has the most cases in that small city in this Dallas DFW area.
Wow. So some of the stuff that people are theorizing may be contributing to that is this whole idea around housing insecurity, right? And so according to Wikipedia, housing insecurity is the lack of shelter or unstable shelter, right? So you may move from place to place, you may stay with other folks, or there may be a lot of people living in a really confined area. And so we notice that more in poor and probably Black and brown communities. And because of that, they elevate their level of exposure, because they may have to go and live with one group of people and then pick up and live with another group of people, or where they're staying, it's just not possible for them to social distance.
Well, in DeSoto, it's kind of the reverse. DeSoto is a very solid suburban community, and they're not not very dense. And so as they looked at the different cases, it's not coming in clusters of that particular area. It's kind of more spread out. And DeSoto is doing the right things. I know Mayor McCowan, who's out there, she's closed the parks. They've closed businesses. There's social distancing. They've closed City Hall. I mean, so they're doing the right things. They're sending the right message to the community, but yet they still don't understand, what's up with 75115 zip code.
I mean, the data that's coming out now, especially when you contrast it towards the stuff that we already know about race and poverty, it really is very interesting to see how some of the systemic things that we've been talking about and we've been creating strategies around and people have been trying to combat for years really is exacerbating this situation.
In New York, they just getting around to releasing some of the specific race data, and it's revealed that it's a disproportionate impact on both Black and Hispanic people. But the disparities, they were not as great as in some other cities that are, predominantly people of color. Black people make up about 22% of the population of New York, but represent 28% of the deaths from the virus. I mean, that is, and then with Hispanics, they make up about 29% of the city, and they represent 34% of the deaths. And so it's like nobody still has that real answer. Why is that the case? But, after this is all over with, hope we're going to take a deeper dive, in this to see, why is that the case?
Yeah. There are many conversations that are swirling now about, some of the community health indicators that we've seen happening for long periods of time, especially in the Black and Hispanic communities that aggravate this COVID-19 potentially aggravate COVID-19 cases around heart disease, high blood pressure, diabetes, those kinds of disease processes that are really prevalent in the African American community especially. And because, in our healthcare systems and some of our community health work, because we haven't really figured out some robust strategies, that may be, impacting some of the data that we're seeing now. I'm hearing lots of conversation around those kinds of things.
Yeah, just to switch just a little bit, one of the things that when we have a disease like what we're having right now, that gets what they call medicalized. So as you look back in history, there have been different times that we've had breakouts of things and it's been associated with a population of people. And so if you think back to SARS, they associated that with Chinese people. If you think back to Ebola, they associated that with Africans. Recently I was listening to a podcast, Coast, which is a popular one on NPR, and Erica Lee, she's a historian with the University of Minnesota. She has a book called America for American. She talked about xenophobia. Xenophobia is that dislike of or prejudice against people from other countries. And when we think about this disease and people looking at Asian people a little bit different, she talked about how people were talking about, are you Chinese? You must have corona, or telling people who are to go back home to China. All of these just unnecessary things that they're pointing the finger at, a particular culture, and just uncalled for. And so when you have things like this pandemic that's breaking out, you tend to, get individuals that get profiled during this time. And so if you think back to SARS, when we had that a few years ago, that was associated with Chinese people. When you think back to Ebola, that was associated with Africans. Historically, what's been pointed out is that prejudice come out even more and they get what's called medicalized.
Right. So, I can understand where folks are just really kind of grasping for some answers, or they're looking for some themes in the data that we have. But I would just have to ask the question, if the knee-jerk reaction was that quick and that swift and that intense, then that would indicate to me that there were some underlying racial tensions, racial issues, some unresolved things there, or some knowledge sharing that needed to happen so that these kinds of activities wouldn't, propagate so hard during these times of uncertainty.
Yeah. So low-wage jobs, in these fields, we're going to take a look at again, like in the retail, hospitality area, those individuals are going to be impacted. And we got to make sure, I know we got the stimulus package that's going to support some of those families, but when we come out of this, companies, how are you going to show up now that individuals have sacrificed, been on this front line?
Yeah.
And fortunately, we did have some momentum going with the, minimum wage, that was going. So it'll be interesting to see kind of where that ends up, after this is all over with now, to be able to support those, again, who we call essential workers who've been out on that front line, that as we walked into the grocery store expecting things to be on the shelf, and these individuals, they're doing that. And so, those are our heroes.
Yeah.
I'm proud of Mayor Johnson here in Dallas, and as we record this today at 7 o'clock tonight, he's asked everyone to come outside at 7 p.m. to give a round of applause for those essential workers.
Like they've done in so many other cities, and so well deserved. I mean, and the House and the Senate, they are trying to act accordingly. So the Family First Coronavirus Response Act, right, that was passed in the House and in the Senate, basically is guaranteeing sick leave to people who worked for companies of 500 workers or less. But that only makes up about 20% of private sector workers, right? And so regardless of what race you may be, socioeconomic wise, that leaves a large number of the population who works for some of these larger restaurant chains and supermarkets and retailers who don't fall into that category, where there's this level of uncertainty, and they were already inhabiting low-wage positions. There is this thing called the working poor, where people are gainfully employed but are still below federal poverty guidelines, and there's a huge chunk of our population who would fall into that category and wouldn't benefit from this Family First Coronavirus Response Act.
Well, there's lots of things that's going on with this right here that we got to shine this light on, spotlight. And so there's prejudice that's there that, is swelling up. It's like we got to defeat that. There is low wage workers who are still our essential people who are on the front line. Like, how do we support them coming out of this? There's the housing. And so many things are going to bubble up to this top right here that we got to make sure that we stay focused on.
Yeah. And
so we want to, this has been an incredible showcase here today, because, man, I get to thinking about, all the work that has to happen, and we're living in a day and time that we have never seen before.
Yeah.
And so thank you for listening to Cosmetic,
where our conversations are global,
globally minded, and locally focused.
Check us out at www.ymcadallas.org/cosmetic.
And as always,
stay dynamic,
stay energized,
stay cosmetic.